Assalamualaikum and good morning to honorable judges and everybody. Today we will be presenting our research entitled Perception of Dental Medical Pharmacy and Clinical Health Sciences Student on People with Disability and Correlation with Educational Experience. This is the outline for our presentation today. Disability is defined as a relationship between body function and structure impairment, activity limitation, and participation restriction with one health condition, personal factor, and environment. In Malaysia, people with disability or PWD is categorized as those with physical, intellectual, psychological, and sensory impairment. It was reported that PWD have poor quality of life, experience various health complications, demonstrate low utilization of professional healthcare services, and experience challenges in accessing healthcare services. One of the challenges reported by patients were communication difficulty and lack of empathy and competence demonstrated by healthcare practitioners. On the other hand, healthcare professionals expressed discomfort and lack of confidence in managing PWD, which was related to inadequate contact and poor training in this area of patient care. In order to prepare future health professionals with knowledge, skill, and positive attitude in managing PWD, university education therefore plays a crucial role. While many studies have investigated level of attitude, exposure, and educational experience among healthcare students towards PWD, such situation in Malaysia is not thoroughly explored. So the objective for this research were to investigate the perception of attitude towards and exposure on people with disability among dental, medical, pharmacy and clinical health science students at University Technology Mara, and to determine student perception of their undergraduate training in preparing them for managing PWD. This is a descriptive quantitative cross-sectional survey using self-administered questionnaire conducted online. The questionnaire was developed from existing literature and underwent content and phase validation prior to the main survey. The study involved all final year students from courses related to clinical healthcare practice in UiTM for 2019-2020 academic session. These are the list of programs which students were involved in the study. Quantitative data was analyzed via one-way ANOVA, chi-square, and Fisher-Exact test using SPSS. Next, results. We have obtained participation from the majority of students across the program, ranging from 61% to 100% response rate. In general, more than one-fourth of students from each program reported having a family member who has a disability, except for optometry. Most occupational therapy students reported having family and patients who are PWD. Only a small percentage of students across all programs cited having a PWD as a friend. The majority of students had experience managing patients with physical, intellectual, and psychological disability, but not those with visual and hearing impairment. There is no significant difference in terms of contact of respondents with PWD across all programs. The overall mean attitude ATDP scores of students in each program were within the middle range, which were categorized as neither positive nor negative, with no significant difference across the cohort. A significantly higher percentage of occupational therapy and nursing students reported positive experience in physically disabled patients. There was a significant difference in terms of student differing experience treating patients with intellectual disability across all programs. The majority of students across all programs noted positive experience in managing this patient, except for those from pharmacy and nutrition dietetics. There was an insignificant difference in terms of student differing experience in treating patients with psychological disorder across all programs. Significantly, more than half of students from each program reported that they have positive experience in managing patients with visual disability, except for those studying medicine, pharmacy, physiotherapy, and nutrition dietetics. A significantly higher percentage of dental students, 81.8%, indicated positive experience in managing patients with hearing disability.
A significantly higher percentage of occupational therapy students cited comfort in managing patients with physical disability. Significantly, most medicine, physiotherapy, occupational therapy, nursing, and optometry students indicate that they felt comfortable in managing patients with intellectual disability. More than half of medicine and nursing students feeling comfortable managing these patients with psychological disorder. There was no significant difference among students in treating patients with visual disability across all programs, with between 48 to 60% noted feeling comfortable. Similarly, there was no significant difference in terms of student comfort in treating patients with hearing disability across all programs, with between 48 to 62% noted feeling comfortable. The majority of dentistry, physiotherapy, occupational therapy, and nursing students perceive that they receive adequate training in managing PWD, which was significantly different in responses across the program. Overall, perceptions of students towards adequacy of training in managing PWD have no significant impact on their attitudes towards this patient cohort. A significant correlation between students' perception of training with positive experience was found for all categories of patients. Those who cited having adequate training in managing patients also had positive experience in managing all groups of PWD. Similarly, a significant correlation between students' perception of training with positive experience was found for all categories of patients. Those who cited having adequate training in managing patients felt comfortable in managing all groups of PWD. This study found that many students across all of the programs having adequate exposure in managing patients with physical, intellectual, and psychological disabilities, but not those with visual and hearing disabilities. This may be related with reduced access to and low utilization of healthcare services. Adequate exposure can be achieved by exposing the students to this patient. This study also found that students' attitude towards PWD is described as neither positive nor negative. Apart from that, the insignificant difference between students' perception of training and their level of attitudes reported in this study justify the needs for enhanced or thorough curricular review that are effective in improving students' attitudes towards PWD. This is because having a positive attitude towards PWD is of the utmost importance if the profession seeks to uphold the principle of professionalism in patient care. The differing experience noted by students across the programs in managing PWD can be improved by presence of knowledgeable and skillful experts to guide students' educational processes and also adequate infrastructure, facility, and resources in order to enhance the students' positive experience in learning. This study also found that students' comfort level in managing PWD was significantly associated with their perception of training. It was found that innovative educational programs that focus on the management of PWD, such as visual arts, extramural educational activities, and sign language communication training have been effective in improving students' level of comfort, attitudes, and willingness in managing these patients. In order to develop an effective curriculum that focuses on developing knowledge, competent skills, positive attitudes, and increased experience in managing PWD, reference to international guidelines, best practice recommendations developed by institutions globally, and also interprofessional educations may be recommended. Dentists who demonstrate professionalism, knowledge, and positive attitude will improve patients' compliance with personal and also professional care, which indirectly improve health status of the patient and also treatment outcome. This study was limited by the movement control order associated with the COVID-19 pandemic. Subject responses may be affected by disruption to their training, including that involving the PWD. In conclusion, students across all programs have neutral attitude towards PWD, which were not associated with how much training they had received in this area. The majority of students have been exposed to PWD has no significant difference in contact experience by subject across the programs. There was a significant association between students' experience and comfort in managing all of the different groups of PWD with how adequate they perceive their training in managing these patients to have been. Significant association between students across the programs were also observed in terms of the differing experience they encountered while managing PWD, as well as their level of comfort in providing care for these patients. These are our references that we use in this presentation. Thank you.